And perhaps even more impressive was in the entire nation of Japan in 1958, how many autopsy proven deaths were there from cancer of the prostate? 18. The most mind-boggling public health figure I think I've encountered. But by 1978, 20 years later, they were up to 137, which still pales in comparison to the 28,000 who will die from prostate cancer this year. Well, now, along about this time, it began to be apparent to me that I was encountering multiple cultures where cardiovascular disease was virtually non-existent. And it just dawned on me that there might literally be more bang for the buck if we could get patients, because this was a leading killer of women and men in Western civilization. If we could get women and men to eat in a way to save their hearts, then it would markedly likely diminish the common Western cancers of breast, prostate, colon, and maybe pancreatic. So I ended this search and in the office of the chairman of cardiology and asked if I could have a few minutes at their meeting to propose a study treating patients seriously with heart disease with plant-based nutrition. And that was granted, and I was able to acquire those patients, and that's how it kind of got all started. And I really got to be hooked on it when we began to see these results. Now, I should share with you that the thing that I was most apprehensive about when starting this was how can I get patients to make this kind of nutritional change? And for that, I decided to use the same mantra that I had been using for my cancer patients that I'd learned years ago from a marvelous West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer, and patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So for the first 5 years of the study, I was seeing every one of the patients in my office every 2 weeks to go over their every morsel they've been eating, check their blood pressure, their weight, and so forth. And at the end of 5 years, I got more courageous and I began to see them on every month. And then at the end of 10 years, they were now on pretty well autopilot. I began to stretch it out to once, that is to see them quarterly. And then at the end of 12 years, we felt that was long enough. And that's when we wrote up the study. So that was just the background that I thought it would be important to share with the audience today. There's another couple of patients that I wanted to, comment on. And that is, excuse me, and that is, this is a patient from Canada, from Newfoundland. And at age 44, this gentleman had had a stroke. And it was the carotid on his right side, but he had a full recovery. But at the same time that he had that, he was having rather significant angina. And somehow they found a surgeon in Toronto who was willing to take on this patient who had had a stroke and had one carotid gone. But he went ahead and gave him a bypass operation, and he did surprisingly well. Now he was aged 69, and he was in trouble again. He had gained 40 pounds. He had angina. He had diabetes. He had erectile dysfunction. And his one remaining carotid artery on the left was 90% blocked. And he thought that this was going to be the end of it. Of all things that have happened at this time, his 37-year-old daughter had a heart attack. And during her convalescence, she found a book called Prevent and Reverse Heart Disease. And she said to her father, "Pop, we really got to do this together." And they did. And the only reason I found out about it was when I got a letter from Bob Mercer thanking me for writing Prevent and Reverse Heart Disease, because what happened after a year, he lost 40 pounds, his angina disappeared, his diabetes disappeared, his erectile dysfunction disappeared, and his one remaining carotid artery, which had been 90% blocked before the start of the program, was now 67% blocked. So it was really pretty exciting how, when you see these reversal events, to know how exciting plant-based nutrition can be, or especially if we can get this more widely spread. Another patient is of interest was a 55-year-old gentleman who again had a right carotid lesion that resulted in a stroke. And so he came to the clinic and he had this right carotid operated on, and everything was fine for the first 24 hours, and then it shut down. No new stroke, because he'd already had a stroke from that blockage. But so his right carotid was now gone. And everything was going fine for the next 5 years, but he began to notice that his left leg, his calf, was really tightening up on him after a certain distance that he would walk. And when he would go to bed at night and put his leg up flat on the bed, within about 20 minutes, he'd get this severe numbness and tingling that was driving him crazy. So the doctors gave him the options of having the leg operated on for the blockage. But before they could operate on the leg, they said the one remaining carotid was enough of a blockage that it warranted having surgery. Of course, he was extremely apprehensive because of what had happened with the earlier carotid surgery on the right side. But he did have the surgery, and it was successful for the carotid artery, and now the attention went to his leg. They first tried stenting. That was unsuccessful. They then tried an open operation with bypass grafting, and that was successful for 24 hours. And then it recurred. And now he was disappointed because there was nothing further they could do with the leg. They came to our program, and literally it was very exciting. Within about 6 weeks, he noticed the diminution, especially of that nasty problem when he put his leg up at night to go to sleep. All that numbness and feeling disappeared, and his walking distance improved. This next was kind of fascinating. There's a friend of mine, a patient from the West Coast called Stanley. And he was the oldest patient that I started this program with. He was 87. And he was told that he had to have bypass surgery, but he was convinced that bypass surgery in his frail body would finish him off. So he wanted to go plant-based, which he did. And every year I'd get a call or two from Stanley letting us know how he was doing. And last year when he called, he didn't ask for me, he was asking for my wife, because he wanted to have a host of many, many different new recipes because he was having a dinner party. So eventually Anne asked him, what was the dinner party for? And he said, well, I'm celebrating my 100th birthday. Now, this year when Stanley called, he called because he wanted to remind us that he was now 101. Now, before I turn it over to questions, I just had one comment about the medical profession itself. I really feel that if we're honest about it, we have a bit of a black eye, because all of us have known, literally now going back 90 or 100 years or more, that there are these multiple cultures on the planet Earth where heart disease is virtually non-existent. What have we done to bring the magic way of living of those societies where the heart disease is virtually non-existent? Why haven't we brought that to this country? Why is it that we insist on trying to use drugs, stents, and bypass, none of which have a single thing to do with the causation of the illness? And it's anticipated, I believe it's by 2030, that the medical bill for cardiovascular disease in this country will be 800 billion. That's really unacceptable. And we can change that. One final thought. Every single patient with heart disease in this planet at one time did not have any heart disease. Thank you for your attention.